Hello, my name is Bindi and I'm a Dementia Voice Lead for the Alzheimer Society. During 2019 to 2020, I led on a project Alzheimer Society was commissioned by West Yorkshire and Harrogate Healthcare Partnership, who were part of the NHS England Dementia Pilot. The overall project at the time looked to reduce non-essential acute hospital admissions for people living with dementia. Advanced care planning, also abbreviated to ACP, was an area of work that was identified by local stakeholders in West Yorkshire and Harrogate, which could potentially support this plan. Data showed people with a diagnosis of dementia were far less likely to have a completed and recorded advanced care plan when compared to patients with other long-term health conditions and diseases. Advanced care planning. It's a process that enables individuals to make plans about their future health and social care. Unfortunately, people with dementia are still not routinely involved in advanced care planning. People affected by dementia identified the following barriers in accessing advanced care planning conversations: lack of knowledge and awareness, difficulty in finding the right time, a preference for informal plans over written documentation, constraints on choice around future care, and a lack of support to make choices about future healthcare. If advanced care planning is not discussed or recorded, then are we being person-centred? How are we enabling people to feel in control of their health and social care without these discussions? This is why it is so important. We were commissioned to produce a resource to enable people living with dementia to have advanced care planning conversations, as well as health and social care professionals. Our project focused on involvement of people affected by dementia from the very beginning. Advanced care planning is a real big area of conversation. It wasn't just people affected by dementia who didn't fully understand what ACP was, but many professionals had different views on it too. We spoke to healthcare professionals and people affected by dementia to understand what people's perceptions and understanding was in relation to this very broad topic. ACP was not just about things like a do not resuscitate or refusing medical treatment. It's thinking about and deciding how you would want personal care, if at all, what food you like and don't like, your routine, and so much more. What, who, how, and when. Due to the limited timescales for this project, we wanted to try and achieve the most qualitative and quantitative amount of data from people affected by dementia. We conducted local workshops in the region and an online national survey. Of 120 participants who took part, 36 people were people with a diagnosis of dementia, and the remaining participants were carers. We also worked with a local learning disabilities group to gather feedback on accessibility of the resource. In order to be able to draw comparisons and themes from the input, we kept questions from the survey very similar to the activity-based questions that we used in the workshop. In the workshop, we designed an interactive picture of a journey, allowing participants to map out when they feel, either now or using hindsight, when conversations around future planning would be a good time for them, and then leading on to what area of future planning they would feel willing to engage with initially. We were aware that no one's journey with dementia is ever the same, simple, straight, or easy. There was much to consider. The most common theme to emerge from the workshops and the survey was what's important to me. Many participants felt that a topic with that title would be a good start to initiating any conversation, and that it can then be tailored to that individual. People living with dementia and their carers may have different ideas about when is the best time to begin conversations around advanced care planning. Over 70% of the survey respondents felt that care preferences, advice on lasting powers of attorney, finances, advice on medical decisions, and end-of-life preferences should be included in the resource. Both people with dementia and carers identified in their top tips that time is a key factor to these conversations, also noting the need for it to be an evolving conversation and one that should be open and revisited. From the engagement, we were able to put together a first draft of the resource and presented it to a diverse group of people affected by dementia. These were individuals who had not been involved in the project earlier, meaning their feedback was from a fresh perspective. We were given a valuable positive feedback on the draft, along with some additional suggestions, and all feedback directly shaped the visual and the technical content of the resource. The resource was printed and distributed among internal and external stakeholders, as well as creating an online copy in March 2020. This proved highly useful as the UK entered its first national lockdown. Hard copies were not available during this period, meaning true evaluation at the time was thwarted. Looking at the design of the resource, there are 4 cards. The front page is an introduction to the topic. The second page lists conversation starters and tips from people affected by dementia. The third page is a space to capture any notes of conversations. The back page lists next steps. It was designed with people affected by dementia as a conversation starter tool that would be universal to anyone to use, as why wait for a health condition to come along before entering into such conversations? The universal theme was important as this was something that a healthcare professional could also introduce, a family friend member or a carer could also introduce. The resource is available online to read, download, and print. Thank you.